Well, I grew up in New York and went to undergraduate school at the State University of New York in Buffalo, which back in 1970, if you can imagine, the tuition was $500 a semester. So it was an educational bargain. Good school, I got a good education there for a wonderful price. And then I went on to medical college at the Jefferson Medical College, which is now Thomas Jefferson University Hospital. And while there, I just began with a view towards becoming a family doctor, because Jefferson Medical College had a large family practice program. So I did a rotation in Mooresville, North Carolina with a family doctor, and down there I really fell in love with the Southeast. So that became my mission, was to eventually practice medicine in the Southeast, particularly the area of North South Carolina. So my internship was at Spartanburg Regional Medical Center. It was a flexible, a rotating internship, and they don't have many of those anymore. But it provided me with a broad base of surgery and OBGYN and medicine, of course. And I did a month with Dr. Dorchek, a cardiologist at the time, and he was doing heart caths. There wasn't interventional cardiology, was not even in existence at that time. They weren't doing angioplasties. But I fell in love with the concept of cardiac catheterization and decided I was going to become a cardiologist, and I abandoned the idea of being a family doctor. So I went back to Philadelphia and did my internal medicine and cardiology training and fellowship. My area of specialization is interventional cardiology, which of course is the field where we do cardiac catheterizations and angioplasties or balloon procedures and placement of intracoronary stents. And I developed that interest while at Jefferson. I worked with Dr. Sheldon Goldberg, and at that point we were interested in infarct size limitation, which means patients are having a heart attack. We used to take them to the cath lab and try to localize the blockage. At that point we didn't have intracoronary stents, but we did have angioplasty balloon catheters, and we were able to put clot-busting medicines within the vessel to open up the blockage and reduce the heart attack size. And this is a very rewarding experience to take a very critically ill patient who's having severe chest pain, and EKG looks horrible. Once you open up that vessel, the patient feels better. This is a very rewarding experience, most importantly for the patient, but also for the doctor. Well, I enjoy playing golf. Unfortunately, because I spend so much time in the cath lab, I'm not a very good golfer, but I do enjoy playing golf and try to do that at least 2 or 3 times a month. And of course, spend time with my family and exercise a little bit. Probably should exercise a little bit more. That's about it.